There's two types. There's round and ergo. Who would you put an ergo in versus a round, and how's that woman
Well,
maybe different?
the ergo is going to, they both really can very easily mold the lower pole of the breast. And I think the insertion techniques are such that it is a little bit different. Not that we have to handhold, whereas with some of the other implants that have been traditionally used in the U.S., kind of what you see in the operating room, oh, that looks great. Okay, that's what it's going to look like. Techniques that we use surgically for Motiva implants, it may not look exactly perfect on the table because we want this implant to do its work post-op as well, which is development of that lower pole. So there are some patients that have what's called a constricted lower pole that don't have much distance from the nipple to the crease under the breast. So that's going to be one that maybe needs the ergo version. If they have enough of their own upper pole breast tissue, we really want that implant to fill that lower pole. I think for the round, that's more upper pole fill. Although both still develop the lower pole nicely, those are the things that as I make my preoperative measurements and talk with patients that we certainly absolutely 100% of the time spend a lot of time talking about.
Motiva implants are available in your practice today.
Absolutely.
What do we do
Yep.
if we want to come in for a consultation and play with them ourselves?
Well, consultations are always free. So, but coming in, it doesn't cost anything. And again, for what we call the boob curious, I think patients that have been interested but just don't want to be too crazy big. The other word that I use is ballerina breast. People just want a small augmentation, and traditionally people maybe wanted that C or C plus, and now they come in wanting Bs. So we could still do that with other technologies and smaller implants, but I think Motiva is really set for the future with regards to some of these maybe less is more augmentations. And so calling the office and talking to my patient care coordinator, we can get you in really quickly. The surgery is really quick as well. I mean, it takes an hour and 15 minutes maybe to do an augmentation. I think the one thing that sets us apart in our practice, I feel like I really do partner with patients through the entire surgical postoperative course. Everybody gets my personal cell phone number. They call me day or night, regardless. You and I talked about earlier that there are no dumb questions. So, I do this all day, every day, and patients do this preferably once in their life. So, I try to be there for them, through thick and thin, hopefully more thin than thick. So,
Okay, give us your Instagram handle and your website.
drleebdaniel.com. We have a couple of other sites, but that'll direct you. And then Instagram handle is pretty easy to remember, Best Plastic Surgeon. So
That's you?
that's me.
I finally found him.